Good evening, everyone. Thank you for joining us. My name is William Cook and I'm the Academic Event Officer for the New Zealand Medical Student Journal this year. And we're very kindly joined by Dr. Tony Fernando this evening to talk about one of the articles he's written for the most recent issue and to give you at home in lockdown some tips about how you can improve your sleep as well. So without further ado, I'd like to invite Dr. Tony Fernando, Auckland psychiatrist and sleep specialist, to introduce himself and talk to us this evening. Thank you.
Hi, everyone. So I'm Tony Fernando. I'm a psychiatrist and also a sleep specialist. And I did my psychiatry and sleep medicine training at the University of Pennsylvania in the US, and then moved to New Zealand after that, and have been seeing sleep patients for, scary to say, 20 or so years. So I'm really happy to be part of this program. I'm passionate about sleep. Medical students in particular are an interesting group about in terms of having sleep difficulties. We've done a study, many years ago now, looking at medical students and sleep, and a fair proportion of medical students do have problems with sleep. And I think it's because of a few things. So number one, a lot of medical students or people in your age group are actually sleep deprived. Many of you think that sleep is something that's dispensable, that you can push on the side, and that there are more important things to focus on rather than sleep. And that's actually a myth. That's actually not very smart, because sleep is really essential for optimal brain functioning. So if you put sleep on the side and you're prioritizing other things, like you want to study more, hoping that you'll get higher grades, it's not very good science. You need good quality sleep to actually perform optimally. So that's one reason why medical students have sleep issues or feeling quite fatigued. And then part of being a medical student would be our interesting personalities. Many of us in medicine are perfectionistic, tend to be anxiety driven or goal driven, and then as a result we become quite anxious. That can ruin our sleep, that can result in problems falling asleep and poor quality sleep. And the age group that you're in, a lot of medical students would have features of delayed sleep phase, which would be, in layman's terms, many of you are owls. So that's a biological tendency from the age of 13, 14 until your early 20s. And if you're an owl, you're likely to feel sleepy much later after midnight. So that already can result in problems with sleep. You go to bed, your brain is still very, very busy. And then in addition to that, your lifestyle, where you're blasted by blue light constantly, like what we're doing tonight, which is not a good thing. Blue light devices 2 or 3 hours before sleep can delay your melatonin release and can make your body clock shift later, which can also cause problems with sleep. So you're a special bunch. You're at high risk for a lot of sleep issues. So I'll start with that, Will.
I guess firstly, Dr. Fernando, you mentioned that a lot of us have issues getting to sleep if we're the night owl variety, and blue light, of course, is a classic cause for some of us who use computers and other screens too late at night. Do you have any other tips to improve our sleep hygiene that we can include in our daily routine?
So before we move on from blue light, very specific recommendations I make regarding blue light, because it's inevitable. You guys will be exposed to it. A lot of our study materials are online. Many of you don't use actual books anymore. So if you really have to use blue light or blue light devices, basic recommendations would be turning down the brightness and the intensity of your device as much as possible. as in the darkest possible. It's not practical if you're doing pathology or radiology and you want to look at things. But if you're just basically looking at notes or slides, tone it down as much as you can. Second practical technique regarding blue light is purchase those cheap blue light blockers. You can get them from AliExpress for $5, $10. You can get nicer ones for $100 if you go on eBay. But basically, you want to cut out blue light. So that's in terms of managing blue light exposure. And then you're asking Will about other techniques for sleep.
Yes, I mean, what's your evening ritual, for example?
Oh, I'm not a good example.
Okay.
No, just joking.
Your perfect world patient example, you would tell your patients in.
No, first of all, if you don't have any sleep issues, you don't need to worry about what I'll be talking about. If you have sleep issues, particularly problems with insomnia, which is one of the most common sleep problems, there are a few basic recommendations which we call sleep hygiene. Yep. So or good sleep health. So the basic ones include blue light management. So that's one. For me, that's actually the most important nowadays. 10 years ago, we didn't we didn't worry much about blue light, but now it's I think blue light is toxic for sleep. That's number one. Number two is having set routines. When we get into certain routines, let's say an hour before you go to bed, you have your rituals, you have your warm bath, or you have your nice tea, or you're now changing into your PJs, or you're now about to read your nice book before sleeping. Having these set routines in a way it primes the mind that, hey, you're moving now into sleep mode. That can be helpful in terms of conditioning the mind to relax. We're now moving on to a relaxing phase. Whereas many of us, I used to, when I was a med student or a registrar, just work. I was a geek, so I was reading a lot and just constant work-related stuff. And then you go to bed, you fall asleep. It's not a very good thing if you have sleep issues, because when you go to bed with your mind being busy, quite alert, there's a good chance that your sleep quality will be poor. Mm-hmm. So routines are important. Number two would be avoiding substances that can actually cause problems with sleep. And for your age group, alcohol is one. People think alcohol can help them go to sleep. In a way, it's true, but the quality of sleep is poor. Yep. And then also for medical students is, how much caffeinated drinks have you actually had? Caffeine or energy drinks can last in the system for sometimes 8, 10, 12 hours. I'm giving you the extreme. But I've had patients where the only coffee they're allowed is the morning, because if they have coffee at lunch or after lunch, they know that they're still wired. So avoiding substances that can cause problems with sleep is important. And then, no, I'm blanking out. Those are the key things I can remember now in terms of sleep hygiene. But rituals, routines can be very, very helpful. Quieting the mind, especially if you have a busy mind, quieting the mind is crucial. And what are different approaches? There are the easy ones, like instead of engaging with your thoughts, reading not work-related stuff, not school-related things that are actually quite relaxing for you, or podcasts. I'm very big on podcasts. I constantly listen to podcasts. And there are certain podcasts I know that if I listen to it, it's just, it's very relaxing. It's easy to go to sleep. So making sure you're able to shift attention from constantly thinking to things that are relaxing. And then you have age-old practices, proven practices, that can decrease your busy mind, your alertness, and also enhance your parasympathetic system, which then results in feeling relaxed. So what are these age-old practices? Yoga, as well as meditation practice, meditation, mindfulness meditation. They can lower the busyness of your brain and set you up for better sleep. So those are the things I can think of off the top of my head, Will.
Thank you very much. I think that's all really important for us. As you say, not everyone has sleep problems, but those of us that don't, can improve, I guess, the rest we get if we.
Yeah, it can be you can be optimal with it,
That's
optimal
right.
with your sleeping.
Before we move on to perhaps talking a bit more about sleep physiologically, I'd be interested to know firstly what podcasts you listen to that are so relaxing.
This is okay. I listen to a few. Um, One is I like All in the Mind, which is an Australian podcast, but that's a little it's light science, a lot of psychology, psychiatry, neuroscience things there. Um, what am I? Well, the favorite podcasts I listen to are Sam Harris. So if you're quite a anyway, I won't comment, but Sam Harris. And then I listen to a lot of podcasts by Buddhist masters. So these are meditation masters. So they talk a lot about the mind and managing the mind. So those are my three common go-to podcasts. And then actually one podcast it's not very relaxing, really stimulated me is listening to Daniel Radcliffe. The first chapter of Harry Potter, Philosopher's Stone, is free on Spotify. It's so addictive. It's different, Daniel Radcliffe reading Harry Potter. That's not good if you before sleep because you'll start thinking about Harry Potter. So anyway, that's not related to sleep really.
Thank you so much for those. I guess the Auckland medical students, and just to introduce you further to some of the Otago students perhaps, we know that you're a great proponent of meditation and have lectured us in some of the more medical benefits of having a quiet mind and being mindful of your thoughts. And I think a lot of us know about meditating in the morning, starting off our day well, but perhaps not as many of us meditate in the evening. Is that something that you encourage strongly?
Okay, so depends on what you're using meditation for. Yep. So traditionally, mindfulness meditation specifically, it's designed to it's a teaching program for the mind. So when you do mindfulness practices or when you do mindfulness meditation, the goal is actually to enhance alertness and also to notice and be accepting of stimulus. So thoughts, sounds, experiences, emotions, and annoying feelings. So you become aware of them and you learn to accept them and let them go. So traditionally, mindfulness should be done. Mindfulness practices are done at the time of the day when you're most alert because it's an alerting awareness training. However, I also I ask some of my patients to learn mindfulness, but more focus on body scanning and also basic just breath meditation, because for some of them, that will help slow down their thinking. And an over busy mind, a ruminating mind, is one of the most common reasons for insomnia. So learning how to slow the mind down by paying attention to the body or your breath can be a very helpful technique for sleep. Also, when people wake up in the middle of the night, a common response is, OMG, why am I awake? So they shift into a fight or flight response. I should sleep, I should sleep. What happens now is that the brain wakes up more. So instead of focusing on, oh my gosh, I'm not sleeping, this is disastrous, what will happen tomorrow? if they know how to do basic breath meditation or body scanning, they shift their attention from not sleeping to, that's all right, I'll just focus on relaxing. And then it's easier for them to go to sleep. So when I talk about mindfulness for sleep, that's not the usual way how it's done. Yep. So, but there have been studies on using mindfulness techniques on insomnia, and they can be very helpful.
Wow,
So it's a
interesting.
long-winded question, a long-winded answer, Will. You have to stop me once in a while because I overtalk.
That's okay. That's very interesting. Thank you for clarifying that. I think a lot of us get confused about mindfulness versus meditation, or rather mindfulness being an example of a meditation that one can do. So
Yeah.
that's great. One question we had a couple of times, which perhaps isn't as relevant to us now as medical students, but into the future, is when we're a junior doctor on call or on a long day,
Yeah.
on a series of nights. How did you, I guess, get through those years, and how do you encourage us to manage them as well?
Yeah, I'm not a good example again because during my time, I did my medical school in the Philippines. And even as medical students, we would go on call every 3 nights. It was horrible. It was nasty. And we would fall asleep in front of the operating table while you're doing your retraction. You just start nodding off. We would sleep on the floor of the OR. It's very, very bad. And it was a little better when I was doing my registrar training in the US. But nowadays, you guys are lucky where um, employers think about your sleep and wellness. It's still not great, okay? So if you ask me, shift work should not be spelled with an F. I don't know if you got that one, because it's very unphysiologic. It's not good to the system, but someone has to do it, yeah. Um, the good news is there are shift work protocols now. There are recommendations, a few of them are evidence-based, that can help people go to sleep after they come off from a shift. Okay, so after a shift, let's say you did a night shift and you finish work at 6 a.m. and now you want to go to sleep at 8 a.m., which normally is the time when your brain is becoming quite alert. So a few techniques include wearing sunglasses, blocking out light as soon as you leave the hospital. Or even as soon as you finish your shift, wear blue light blockers or wear sunglasses. Because what you want to do is to trick the brain into thinking it's evening. But if you leave the hospital and you go out and you expose yourself to the sun, your eyes to the sun, now your brain thinks it's daytime, it's harder to sleep. So using sunglasses can be very helpful. Also taking melatonin to trick the brain that it's evening. In other countries, melatonin is over the counter. So everyone has access to it. They just go to a chemist or a grocery store. They can get melatonin. In New Zealand, it's a prescription medication. So if you're having problems after a shift, using melatonin or asking melatonin from your doctor can be helpful. And sometimes people might have to use low dose of sleep medications just to give them like at least 4, 5, 6 hours of sleep initially. So those are the techniques to help with sleep after a shift. And these are published. Interestingly, even though they're published and publicly accessible, very few people in the industry talk about it. Like I have patients who are pilots and flight attendants, and you ask them, so what's the airline's protocol? Nothing. And then medical doctors, registrars, nurses, ask them, what's the protocol? Do you have any recommendations? Nothing from employers. So it doesn't make sense to me, because it can save your life. I mean, I'm saying I'm a bad example because I was doing sleep medicine training already in Philadelphia, and our research unit there is one of the biggest uh, groups in the U.S. studying um, sleepiness and accidents. You know, we're studying truck drivers, they're studying astronauts, and here I was after a shift, falling asleep on the motorway. I mean, on a traffic light near the motorway in Philadelphia. And I knew the data, I knew the science, but I wasn't. Now I'm more conscious of it. You know, when I'm starting to feel sleepy, I pull over. You cannot fight it. Yeah, you cannot be macho about it. Sleep, when sleep deprivation bites you, you can drink as much V as you want, but your brain will just shut down. You will have micro sleep. So having routines to help us deal with sleepiness or lack of sleep is really important when we're after doing a shift.
That's great. Thank you very much. Speaking of melatonin, we've had a psychogeriatric registrar just comment on our Facebook Live asking that she often sees patients who are on melatonin for more than a couple of weeks when I think the recommendation is that it should only be a short-term fix. Is that correct? Or is it more to do with how the patient responds?
Yeah, both. So melatonin, I'm not sure actually, that's a good one. I'm not sure if there are actual guidelines on how to use melatonin. I don't think there is. If there is, please share it to me, or I just haven't been doing my homework. Melatonin, the reason probably why there's not a lot of guidelines is because in the US, it's over the counter. There's no clear recommendations from the FDA or medical bodies. It's like a supplement. It's just a vitamin in the US. But I'll speak now in terms of clinical experience. Short-term melatonin use can be, we do that for people with jet lag or certain sleep conditions. But I do have patients who have to be on melatonin indefinitely until we have better treatments. I have had patients with intellectual disabilities. They're more prone for circadian problems, and melatonin can be very helpful. Some older patients respond beautifully to melatonin, and they would be on it indefinitely. Of course, when you're treating someone, you would want to see if they can come off the medication, and some do, and some would say, no, Tony, I want to be on this long term. The research on long-term consequences of melatonin is not that huge. The general consensus is it's probably safe long-term. But as far as I know, there are no clear guidelines that I'm aware of. I'm not saying there's none, but yeah, not that I'm aware of. So I'm very open to getting feedback on that. I haven't checked the literature recently.
That's great. Thank you very much. Just if there's anyone who's just joined us this evening, we have Dr. Tony Fernando, Auckland sleep specialist, talking to us about how we can improve our sleep and some of the problems we have with it. Some questions have come in about how we may be able to get 8 hours, but perhaps not all at once or every night of the week. So for example, you might aim to get 8 hours most nights, but if you have a late night conference call and you get less, can you make up that difference later, or is it really important to get consistent sleep?
Again, we're talking about what's ideal and what's practical. So the ideal situation is to have consistent sleep, the duration that your body needs, because not all of us need 8 hours. Majority would, but not all. Some of you will only need 7, and more than 7, it actually doesn't benefit you. More than 7 hours, you're feeling actually sluggish. Some of you will only need 6, and some of you would only need 5. If you're someone who only needs 5, and after 5 you're really good, and if you stay in bed for 8 hours, you might actually develop insomnia because you're wondering, oh, I'm awake for 3 hours. So going back to your question, if you can be consistent with what your body needs and get that, my suggestion is to do that. And there will be times that you can't. You know, we go on call or we go on conference call, and then your sleep is truncated. Then my suggestion, if it's possible for you to have a catch-up sleep, have a nap, I don't think you really make up for it perfectly, but it's better than having shortened sleep. So we have to be practical, especially, you know, as healthcare workers. We will have lots and lots of times in the future where we don't get what we need. My suggestion is, if you can nap, because not everyone can nap. So that's another interesting thing. Not everyone can nap. But if you're sleep deprived and you have an opportunity to catch up during the day, between lectures, go for it. There's also the issue of duration. So don't overnap, because what can happen is if you overnap, meaning you nap for more than an hour, you can actually feel sluggish after that. And it might take a while for your mind to fully engage again. So there are researches on studies on what's an appropriate nap. So it's all, of course, highly individualized, but recommendations are usually in the 20-minute range. If I have an opportunity to nap on weekends, I'm not big on napping, but let's say it's a really good weekend, pretty relaxed, I can nap for an hour, no problems, but I don't think I can do it every day. So we all have different napping profiles as well.
It's interesting because some people have asked about napping as well.
Yes.
And perhaps, I guess, during this time while people have different routines, they may be more prone to, you know, taking a nap that they wouldn't otherwise be able to do most of the working week.
I mean, people, I was listening to a colleague of mine recently who said that you should avoid napping. I don't think you can say that as a blanket thing. And for me, I view napping, if you have an urge to nap, what that says is that your brain actually wants to sleep. If you have an urge to nap, if you have constant urges to nap, then you might be sleep deprived. Yep. Sleep deprived because of your lifestyle, or sleep deprived because of a sleep problem. But if you have an urge to nap, for me, that's a signal your body is craving for sleep. If you can nap and your napping will not affect your sleep that night, I will say, yeah, go for it, nap. So it's the body telling us. So it's being with your body. Pay attention to your body, because our body actually tells us a lot of things, especially with sleep. The body will tell you, I need sleep. And if you have the opportunity to give in, if it's possible and not going to be detrimental for your sleep that night, I will say, go ahead.
What happens if you wake up in the middle of the night, Dr. Fernando, and you're not necessarily an insomniac, but you're not exactly good at counting sheep either? What do you tend to recommend for something like that?
First of all, waking up in the middle of the night is not pathologic. It's interesting because the concept of a solid sleep, that it should be continuous, is a relatively new concept. I think it's only the last 2-3 generations who think like that. There have been reports that, you know, in the 18th century, in England, they've found reports of people, diaries where people actually have 2 sleeps. They call it the first sleep and the second sleep. So after tea, they sleep 3-4 hours. Then they wake up. Sorry. They do chores. They do all sorts of things, storytelling, and then they have their second sleep. So it's possible that this concept of a solid 8 hours is actually artificial. So it's not unusual to actually wake up in the middle of the night. Once in a while, you go to the loo. So the most important thing when we wake up in the middle of the night, as long as it's not, okay, there are different types of middle of the night awakening. So if you wake up in the middle of the night and you're not falling asleep quickly, my suggestion is, number one, you do not catastrophize. You do not let your perfectionistic personality come in and say, I should be asleep. I need perfect 8 hours of sleep. If I don't sleep, I will be a wreck tomorrow. Because with those types of cognitions, what happens is you're putting pressure on the brain. You're asking the brain to perform. Sleep, sleep. You're asking the brain to perform. It wakes up. And then it's harder for you to fall asleep. So most important thing when you wake up in the middle of the night is to chill. It's normal. It's okay. Go to the loo, have a cup of tea, listen to podcasts. Don't look at your notes unless they're really boring. Sooner or later, assuming you don't have any pathology, you will fall asleep in the next, at least within 60 to 90 minutes, which is the normal sleep cycle. The waves of sleep will start hitting your face. So if you're relaxed and chilled, you will feel it, you'll sleep again. But if you stress out, OMG, I'm awake, the waves of sleep are starting to hit you, but since you're too alert, it's not going to work. So again, this is where a calm mind comes in. If you have a calm mind, you don't sleep, or you wake up in the middle of the night, you're calm about it, that's all right. A lot of people don't sleep continuously. I'll just chill or do my body scanning or read something or whatever. And then sooner or later, they sleep again. So our response, how we react to middle of the night awakening is crucial because it can start, if you're constantly worried about middle of the night awakening, you set yourself up for developing insomnia. It becomes a routine. It becomes a conditioned thing that every time you wake up, you panic, you freak out. The brain remembers that. Then you do it every night, then you start developing this response of panic in the middle of the night. Then you'll end up having an insomnia.
That's great. Thank you very much. I'm sure a few medical student A-type personalities will be interested in hearing.
It's probably, 70% of us?
Possibly. Possibly. Someone's asked what benefit, if any, is there in magnesium supplementation in sleep?
Oh, yeah,
is that something that you have?
Yeah. I talk about that to a lot of my patients. Magnesium can be quite helpful in restless legs. However, I've had a few patients who tell me that magnesium has been very helpful also for their sleep. Okay. I don't think there's very good evidence. Again, this is where if you look at clinical trials, I don't think magnesium ranks high there, but it doesn't mean that no evidence in the literature means it doesn't work. So that's one of those things you as medical students have to remember. You can say, oh, there's no published paper on that. Like, yeah, there's a lot of things that help which don't have publication, but magnesium is a pretty benign supplement and they can help, but not as, of course, it's not as high. There are supplements. Melatonin is considered a supplement. Melatonin has more evidence than magnesium, but magnesium would be one of my favorite, over-the-counter recommendations for people, especially if they have some restlessness in their legs. So it's worth trying as long as you're not having diarrhea. But the evidence is slim. But anecdotally, people will say, oh, it helps.
One question that sort of links on to what we were talking earlier about being on call or working overnight is perhaps when you're actually on call and you're allowed to sleep, how do you relax yourself to the point where you can sleep? Because I know from personal experience, when the phone's there on the bedside table, you don't really settle down, do you?
Yeah. So I think for most of us, if we're on call, it's very hard to go into deep sleep. We just have to accept that fact. In fact, if you can sleep during an on-call night, you're lucky. It's considered like a treat. It's a gift because it's hard to sleep because you're hyper vigilant. You're aware. In fact, I remember, it's been a long time since I did calls, but as a registrar, if I find myself sleeping for an hour or 2 hours, I wake up with some sort of a panic, like, oh my God, did I miss a call? And then I check during my time, we didn't have cell phones. We had beepers and I have to check my beeper. And if there's no call register there, I ring the nurses like, did you, anything happening? I haven't heard a call. But that's because we're hyper vigilant. So it's normal to actually not fall asleep when you're on call. In fact, I'm not sure if you would want to go into a deep sleep when you're on call because it can be disastrous if something's happening and you're not waking up. But yeah, I'm not sure if I answered your question, Will.
Oh, that's great. That's exactly
Except, if I were you, I'll just relax, read things, chill out, listen to podcasts, meditate if you want, do some yoga. And if you fall asleep deeply during an on-call shift, you're lucky. Most of us remain in superficial sleep, if not full alertness, even if we're not doing anything, unless you're totally sleep deprived.
Yes.
Yeah.
Someone's asked, leading on from magnesium, are there any other over-the-counter or natural alternative remedies that are good for sort of low level sleep problems, I guess? Someone's given the example of chamomile tea.
Yeah, so I'm not sure if there's good evidence for chamomile. I don't think there is. Valerian has some evidence. Kava has some evidence, but the risk with kava would be toxicity, like liver toxicity. There have been publications on 5-HTP. So these are over-the-counter supplements. However, before I focus on those supplements, I will actually look at, number one, my routines. Again, look at my routines. Are there things that I'm doing that prevent me from sleeping? I will look at, again, like I mentioned for so many times now, blue light exposure. I will even look at the time I'm going to sleep, because sleep is not something we can just will like that. Like, I need to get up at 3 a.m. So therefore I should go to sleep now 6 p.m. All right, I'll go to bed at 6 p.m. It's not going to happen because sleepiness occurs only at a particular time of our 24-hour cycle. So all of us have individualized windows when sleep will most likely happen. So not everyone will feel sleepy at 10 p.m. I'm a 10:30, 11 p.m. person, or later, of course, the later, the more sleepy I am. Owls would naturally feel sleepy after midnight, 1 to 3 a.m. So if they have sleep issues, using supplements or medications will not work. The important thing is actually timing their sleep properly. So what I'm talking about are, they're part and parcel of what we call CBT for insomnia. So cognitive behavioral therapy for insomnia looks at non-medication approaches that are evidence-based for insomnia. And there are online programs for this, so they're expensive though, you have to pay. So there's a program from Oxford called sleepio.com, sleepio.com. There is an excellent sleep program for insomniacs from Australia that combines CBT as well as mindfulness approaches. It's called amindfulway.com.au. Excellent websites. These are online programs where you register and they help you with your sleep schedule. They look at your thinking patterns. And I would focus on that first before supplements. Well, supplements are easy though. Because when you want to train your brain for better sleeps, if you have sleep issues, it takes many weeks. So when you engage in some of the practices I'm talking about, let's say CBT for insomnia, it's not going to work in a week. I tell my patients, follow this. I prescribe them a schedule that's individualized for them when they go to bed, when they get out of bed. And we do that for 3 to 4 weeks. And only then will we know if they're a responder or not. So the problem when people Google things, what can be helpful for sleep, or do this, do that, do this, no one tells them that they should actually stick with the program for 1 to 2 months. So they come to me and say, oh, Tony, I've done that. Okay. How long did you do it for? Couple of nights and it was shit. I said, oh, that's not enough. You should be shitty for 3 weeks before it changes, before it kicks in. So it's important to, when you have sleep issues or you want to change routines, it takes months. There are also a few books that are really good on sleep. So one is called Insomnia Solved by Dr. Brandon Peters. And then there's one called Say Goodnight to Insomnia. I think that's a Harvard book. So they're all similar in terms of their cognitive behavioral approaches to sleep, which involves ideal sleep times for the person, the duration, as well as preparing the mind before they sleep, what to do when you wake up in the middle of the night, a lot of those practical aspects of insomnia.
That's great, thank you. Just to recap that, we'd also had a question from Liz Berryman, who, of course, fronts the Channel
Liz.
app.
Yeah.
Just asking specifically about apps for sleep. You mentioned some of them were expensive, but there are some websites, so sleepio.com and A Mindful Way.
Yeah. So the last time I looked at sleep apps, nothing really impressed me. None of them focused on core CBT for insomnia principles. A lot of them are tracking your sleep, which has its drawbacks. Just imagine the scenario. A lot of insomniacs are neurotic. A lot of insomniacs tend to be control freaks. So what they do, all right, let's download the sleep app. And the sleep app then records your sleep. And the accuracy of sleep apps that are based on phones they're not the greatest. So, or even Fitbit is actually it's not superb, it's okay. So what happens now is that a patient or an insomnia sufferer will be monitoring their sleep like a hawk. So what do you end up doing? They become more neurotic on the data. And then a lot of the sleep apps will talk about music, will talk about listening to meditation. Again, can be helpful, but not really enough for someone with insomnia. I haven't seen a sleep app. The last time I looked at it was probably 2 months ago when we did a big look. And the reason is I'm collaborating with someone looking at a sleep app, developing a sleep app. nothing out there, interestingly, that incorporates good CBT for insomnia principles. Not that I know of. That's in an app format. There are really good apps out there, let's say for anxiety with good evidence, but nothing that I've seen for insomnia. So that's my short answer for sleep apps, and Liz can contact me.
That's great.
Yeah.
Fantastic. I guess one of the other interesting things you talked about in your article, Tony, was the health implications of poor sleep. I think a lot of people know about the causes of bad sleep, sometimes being anxiety, depression, other forms of mental distress. But could you tell us a little bit about some of the more recent research that is linked to poor sleep with, cardiovascular disease and other issues, for example?
This is not a good topic to talk about because people with sleep problems now will develop insomnia because they'll be worried. So the common, of course, the known effects, which a lot of, if you've had poor sleep once in a while, you'll know what I'm talking about, would be cognitive difficulties. It's harder to remember things. You become more irritable the following day. Long term, you're at higher risk for depression, anxiety, even suicide. So there are studies which show that prolonged poor sleep is a predictor for suicide. And then there are a lot of potential health, physical health issues as well. Obesity, which was a surprise. I mean, when the initial work on this came out, I'm not sure now, probably 10, 15 years ago, we were surprised because we would think, oh, if you don't sleep, you become thin or cachectic, you lose weight. Now we know that if you're not sleeping well, you're actually at higher risk for obesity. And then, of course, with the other health issues, cardiovascular issues as well, diabetes. So these are some of the known medical consequences of poor sleep. And if you're not sleeping, again, just think of yourself, if you're not sleeping, how do you feel the following day? In my case, if I didn't sleep, if I didn't have a good sleep, I notice my aches and pains much more. I do a little bit of swim training, and normally I'm okay. I don't get a lot of injuries in swimming, not much injuries. But if I had, let's say, a poor sleep or sleep deprived from a flight, I can feel those muscle tensions and aches much, much more. And I treat a lot of patients with chronic pain as well. And what they've told me is that their pain levels, their migraines and headaches, their arthritis are significantly worse when their sleep is not controlled or if it's poorly managed. So you can also imagine if you're sleeping properly, your body's ability to repair itself is better. You're better in terms of healing. Your immune system would be better. So that's why from the very beginning, the first time you allowed me to speak, I'm emphasizing the need for really good sleep because, and it's not something that's dispensable. In fact, commonly when I give lectures on sleep, particularly to university students, a lot of young people think that sleep is something that we can manipulate. Let's say, I'll just, since I need 8 hours of sleep, I'll divide it through the day. I want to be efficient. I'll sleep 2 hours here, 2 hours here. It doesn't work like that. Doesn't work like it. Our body's not that simple. We have an ideal time when we have to go to sleep, and an ideal time for us for waking up. So there are a lot of variables that we actually have to consider. So sleep is not something we can just manipulate. We can sort of influence it, but not really manipulate it the way we want it to. Yeah.
Fantastic. And Tony, you talk about how there's proven risks involved in judgment and coordination that are important for us as doctors going forward. And I guess a number of discussions go on between the unions
Yeah.
representing doctors in the DHBs about length of working weeks and so on and so forth, and how some training programs have to develop and modify to fit people's changing lifestyles. And do you think sleep should be a part of that discussion more than it has
It
been in
should
the
be.
past?
I'm not aware of. First of all, I have to be to have a disclosure. I usually avoid big organizations or management. I'm allergic to so I actually don't know if management has been talking about the importance of sleep, so I cannot comment on that. Um, but if I were involved in taking care of staff, particularly doctors and nurses who do shift work or training programs, sleep should be factored in because part of our job is to go on call. Um, so making sure that doctors, nurses, or whoever's doing shift actually have adequate opportunities for sleep. You can imagine what will happen, and it's happened many times, when doctors are sleep deprived. We've killed people. No, we've killed people. There are studies on junior doctors and sleep deprivation, and they make much more mistakes. They're worse in terms of procedures. Their intubation skills are crap compared to doctors who had a good, decent sleep the previous night. So in our case, as doctors, the having good sleep is not just a matter of a lifestyle thing. And it's not a matter of of course, it matters, our well-being. But you're talking about we can kill people if we don't sleep well. And I'm not just talking about procedural stuff. You make an error in your calculations of doses of a pediatric patient, you can kill that patient. Just a little decimal movement can kill a neonate. So having good sleeps for us as, let's say you're a trainee, is not just for your own well-being, but for the well-being of our patients. So I'm still surprised that there are no clear guidelines mentioned or taught to junior doctors, registrars, about optimizing sleep if you're doing shift work. It has to be part of our education. And it's accessible, it's not coming from me, it's in published data on shift work sleep disorder. How do you actually remain alert? So one thing we didn't talk about, which is part of sleep medicine as well, is how do we maintain our alertness when you're doing a night shift? So there are recommendations on those, using bright light therapy, using light visors, having scheduled naps, caffeine, of course, judicious use of caffeine. So there are studies on this. How often do you see it? Like, if you're sometimes when you're doing a night shift, if you fall asleep, people might even ridicule you, or you're a weakling. That's actually stupid. If you can catch sleep between patients, do it. It actually makes you a better and safer doctor. Who cares about this badge of being a macho doctor who's not sleeping? They're idiots. If you can sleep in the middle of your shift, assuming it's allowed, it should be allowed, go on. In fact, there was this, and I was interviewed many years ago. I think the news was trying to come up with an interesting angle. There was a case of an Air New Zealand pilot who was caught asleep. Of course, there's two of them anyway, but apparently he was caught asleep in the cockpit. And they want to make a big deal out of it, like he's a bad pilot. I was telling them, no, he's human. You cannot ridicule someone for sleeping. I mean, there have to be better ways to manage sleepiness when you're flying, but I will not judge that pilot as being an idiot because that's what they wanted me to say he's an idiot pilot. It's like, no, that's physiological need. Something needs to be done to avoid it, but he's not a bad person. Anyway, I have this big thing about shift work. Really, it's inhumane. Shift work is inhumane. Anyway,
that's a really important point to make, Tony. So thank you very much for that. Just wrapping up, we have a couple of questions. One we've sort of covered, talking about how it's important to stick to a sleep routine if at all possible, but if you can make up the difference perhaps later on, that is better than nothing at all, of course, especially if your body is telling you that you're tired and you need sleep. So that answers one question. And then another is interesting. We've talked a lot, Tony, about our own needs and our own well-being. And that's important. That's sort of more what we're talking about these days anyway. But of course, for our patients as well, they often are disrupted many times through the night with observations and drugs and other goings on the ward. You know, should we be advocating for their sleep hygiene just as much as ours?
Yeah, that's a really, really important topic. You can imagine what happens in the hospital. Constant bright light, lots of people poking you, even waking up the patient. Oh, I just wanted to check if you're asleep. It's like what? It's incredible. I've seen that so many times. Well, the nurse says, "Oh, I'll just check Mrs. So-and-so if she's asleep." Are you asleep? It's like, sheesh. But imagine you're in a hospital as a patient, your body is broken and you want healing, and you're in this setting where sleep is not valued. It's a variable in future treatment, because it's not happening now, that can actually be modified. And I'm sure if we optimize sleep with our patients in the hospital, they'll heal better. And what are non-pharmacologic interventions? So one is factoring in circadian rhythm, meaning dimming the lights at a certain time to coordinate with sunset, and then brightening the lights to coordinate with sun exposure, or if possible, having our patients exposed to the sun in the morning, or if that's not possible, using bright light therapy, a few hours, let's say 30 minutes or an hour in the morning, that can help the circadian rhythm of our patients. These are low-cost interventions. And that's just in terms of the environment. And what about minimizing checking on patients when we really don't need to? Just being sleep aware, being aware of the sleep needs of our patients, really, really crucial. But I remember, this is very common in wards where, let's say, a patient needs a sleep medication. So let's say they're prescribed sleep medications to help them sleep. It's not unusual that they will be given sleep medications at 7 p.m. because that's the convenient time for the staff to give them the medication. So if you give a patient a sleep medication at 7 p.m. and normally their sleep time is 10 or 11, the sleep medication will go against a very alert brain. The chances of that sleep medication working is slim. So factoring in the circadian rhythm of our patients in their recovery is something that's actually rarely done. In the future, hopefully in your generation, you'll factor that in. In fact, some of the studies are being done at Auckland in the anesthetics department. So the Department of Anesthesia in Auckland has a couple of really smart sleep scientists. So now they're looking at the timing of anesthetics, the timing of operations, when patients will heal better. So, but it's a very small area still in medicine. Again, why is this important? Because we are ruled by our body clocks. And we need to factor in our body clocks when it comes to studying, when it comes to playing sports, when you're at your peak in terms of administration of medications, at what's the best time to eat. So that's a whole new area called circadian rhythm science, chronobiology.
Fantastic.
And,
I
I
think
talked too much, Will, sorry.
No, not at all. I think it's nearly our bedtimes anyway.
No, too early for you guys. Don't.
No, I think that's a really lovely way to round off. Thank you, Tony. Thank you very much for joining us this evening. Just to remind everyone, we've been talking about Tony Fernando's article he's written for the latest issue of the New Zealand Medical Student Journal, issue 30, talking about the importance of sleep, how to improve it, and right at the end there, how we can potentially improve our patients' health and well-being and recovery in hospital as well. So feel free to rewatch the video on Facebook. We'll be posting an edited version on our website, nzmsj.com, where you can watch this, other videos, and read all our issues back about 10 years, I believe. So thanks again to Tony.
Thank you.